Now, when we talk about the superconductive pathway, we know that up here we have the SA node, the three internodal pathways. We have the superior anterior tract, or what we call the fast track, the middle tract, and then of course the posterior inferior tract, or the slow tract, or the slow tract, and then of course the Buckman's bundle. Now from here we know that in about 90% of the population, only the fast track makes it to the AV node. Right here we have a non-conductive wall called the atrioventricular septum, and the only place where the impulse should travel from the atria into the ventricles is through the bundle of His. Now the bundle of His breaks into the left and right bundle branches. The right bundle is actually a very large piece of tissue that comes down and terminates into the Purkinje network. The left bundle, on the other hand, is actually surprisingly a very small piece of tissue. It is then broken down into three different fascicles. The posterior fascicle that covers the posterior aspect of the left ventricle, the anterior fascicle that comes down and terminates into the Purkinje fiber, and then finally the intraventricular septal fascicle that depolarizes the intraventricular septum. This becomes extremely important when we talk about the left bundle branch. Now, as you guys recall in my previous videos, the true pathway of electricity through the heart should be down to the left and towards the front of the body. So the ventricles and the septum should be depolarized from left to right. And that becomes extremely important when you're looking at an EKG and trying to decide. So we already know what the depolarization of the atria look on the EKG. They look like a P wave. We know what the depolarization of the ventricles look on the EKG. We call that a QRS complex. But what does the depolarization of the intraventricular septal look? Well, when we talk about QRST, that's the Q we are talking about. So, if you were to look in your lateral leads, which are leads 1, AVL, V5, and V6, you should have small little Q waves in a normal circumstance. And what this small Q wave is the depolarization of the intraventricular septal through the intraventricular septal. So what happens during the left bundle branch block? Well, the impulse travels down the SA node and the AV node and the His bundle as it normally would. However, it gets blocked at the left bundle. It will travel down the right bundle and depolarize the right ventricle. But then the heart has to depend on the cell to cell to cell to cell conduction of the impulse from the right side of the heart to the left side of the heart. And that's why you get the wide QRS complexes. Because remember, when you're traveling across the EKG paper, we are talking about time. So the longer it takes for the impulse to travel from one side of the heart to the other side of the heart, well, the wider your QRS complexes are going to be. Another thing that you will get with this is what we call a 2 QRS complex phenomena. So what that means is that you will have for when the right side of the heart depolarizes, or the right ventricle, and then another one when the left ventricle depolarizes. Now, if we were to squeeze these two together, then you would end up with something like this in the lateral leads. Okay? And the first part of this would be the right ventricle depolarizing, and the second part would be the left ventricle depolarizing. So what are the criteria that need to be met for a left bundle branch block? Well, the first one you already know. A QRS complex of greater than 0.12 seconds in lead V1, or 3 small boxes. The second one your J point in lead V1 and travel backwards. The very first deflection you come to in your QRS complex should be a downward deflection. Criteria number 3 is the notching of the QRS complexes in the lateral leads. And that's exactly what we talked about earlier. Remember, you get that 2 QRS complex phenomena. And then finally, and most critically, no Q waves in lateral leads. This is the diagnostic criteria. This is the most important criteria that needs to be met for a 12-lead EKG to be considered a left bundle branch block. If you have a left bundle branch block pattern on an EKG, but there are Q waves in the lateral leads, what you have is not a true left bundle branch block. What you have is a non-specific ventricular delay. So I'm going to draw up our heart real quick to kind of talk about that real fast. So if we were to draw up our heart, remember the intraventricular septum, which is right over here, needs to be depolarized from left to right. And this fascicle that depolarizes the intraventricular septum comes off of the anterior fascicle, which also comes off of the left bundle, which is all the way over here. So if we have the left bundle blocked, there is no way that you could have Q waves in the lateral leads. Alright, so let's look at an example of a left bundle branch. What is the first criteria I have to meet? Well, I need to go to lead V1 and assess the duration of my QRS complex. So here's my lead V1. Is my QRS complex wider than 3 small boxes or 0.12 seconds? Well, let's count. 1, 2, 3, 4, almost 4.5 boxes. So yes, I do meet that criteria. What is my second criteria? Well, I need to go to my J point and work my way backwards to see if the very first deflection I come to is a downward deflection. Where's my J point? My J point is right there. So where is the very first deflection when it comes to my QRS complex? Is it downward? Yes. So I meet the second criteria as well. Now, what is the third criteria I need to meet? Well, I need to have notching of my lateral leads. So let's assess my lateral leads. Let's go to lead 1. Do I have notching? Yes, I do. I go to lead 1. Do I have notching? Yes, I do. I have notching right there. Let's look at AVL. Do I have notching? I very clearly do. How about lead V5? It's hard to tell in lead V5, but it is there. But it's very, very obvious in lead V6. So I also meet that criteria. Now, what is the very last criteria? What is the critical criteria I need to meet, the diagnostic criteria? Well, do I have any Q waves in the lateral leads? Let's start with lead V1. I don't see any Q waves. AVL? Nope, no Q waves. And no Q waves in lead V5 and or V6. So I meet all the criteria for a left bundle branch block. So now I can confidently say, yes, what I have here is a left bundle branch block.